Hello and welcome back. I read an interesting article that talks about Bowlby's attachment theory, and I'm going to share with you some of the highlights from that article. But before that, a couple things to keep in mind as we really start to dig a little deeper into lifespan psychology. So I want to point out a couple of obvious distinctions here. First, remember that everyone will go through the various stages of development. Just as I stated in session one, we all turn one and then two and then three and five and so on. So there are certain age appropriate things to consider when you're learning about the stages of development that we go through as we're growing and maturing. These things would include your motor skills, your hand-eye coordination, walking, talking, crawling, and so on. But second, remember that to study psychology is to have a better understanding of the science behind the human mind and behavior. So something to keep in mind is that while we can apply a one-size-fits-all model to the stages of development, if I can put it that way, we cannot apply a one-size-fits-all mentality to the various experiences that we as individuals have all had during these certain life stages. This is a really important distinction to keep in mind. So now, on to that article. Bowlby was one of the first psychotherapists to root human experiences in the inborn mechanisms of the mind. The attachment behavioral motivational system identified and investigated by Bowlby is innate because every young mammal needs the closeness and sensitivity of a caregiver to survive. The child attachment behavior is shaped by the experiences of the first years of life because it needs to learn how to survive in that specific environment, adapting to that specific parent. In accordance with these first experiences, the child builds a series of internal cognitive affective structures, basically the internal working models of the self, others, and the self in relation to others that will guide him into subsequent attachment experiences within his interpersonal environment. So, individuals who are experiencing confusing or who have experienced confusing, frightening, or broken emotional communications during infancy often grow into adults who have difficulty understanding their own emotions and the feelings of others. This limits their ability to build or maintain successful relationships. Attachment, the relationship between infants and their primary caregiver, is responsible for four primary things: shaping the success or failure of future intimate relationships, the ability to maintain emotional balance, the ability to enjoy being ourselves and to find satisfaction with being with others, and the ability to rebound from disappointment, discouragement, and misfortune. So, as we continue to study the various perspectives and theories of psychology, we will find that many adult issues can be rooted back to early childhood experiences. Now, I understand while every theorist has offered their own perspective on where the issues initially started from, like Freud, he emphasized the importance of early childhood experiences in shaping our personality and behavior. Or Erickson, his theory really focused on children developing a greater sense of personal control during those first few years. But the bigger point here is that a lot happens in the first several years of life that can leave a lasting impression on who we are and how we respond to life as we grow into adulthood. For individuals going into the field of counseling, it's important to recognize that psychopathology often derives or is supported by insecure attachment relationships between the child and his caregiver. Because of this, when a counselor is working with their patients, there are a few things that counselors need to keep in mind as they're building relationships with their clients. The counselor must provide the patient with a secure base from which they can explore the painful aspects of life. They must encourage the patient to consider how they relate to important others in their lives. They must encourage the patient to consider how his or her feelings, perceptions, expectations, and actions may be the result of their childhood and adolescent experiences. They must help the patient to consider how his or her models of the self and others derive from either a painful past experience or from confusing messages received by their parents. So get ready. This session, there's a lot to learn, especially when it comes to the early years. But understanding attachment during the first couple years of life is really the first place to start when you're trying to begin putting all of these pieces together.